how can patients benefit from approaching any kind of medical treatment with a more positive and hopeful outlook?
Yeah, I think there's a lot of research out there in the field of positive psychology these days. There's actually a great book, if you're a clinician listening, the book is called Called to Care. It's by a physical therapist named Dr. Larry Benz. And he does a pretty good job in that book of highlighting the research that connects positive clinical outcomes, which is just a fancy way of saying meeting your goals and getting a good outcome after being pain free or long term health, with the notion of patient expectations and patient perceptions. And really, the long and short of it is, if patients expect to get better from treatment, even if it is the same exact treatment, just the simple fact, the same exact treatment delivered to two different patients, one patient expects that they're going to get better and one patient does not expect they're going to get better. The same exact treatment delivered to those two patients will yield different outcomes, in that the patient who expects to get better will get better. Now, I'm not saying that everything that your clinician is going to do to treat you is going to be that way, but for a large majority, and we're still understanding this, the science is still coming out around positive psychology and cognition, and how our brain is really responsible for creating the reality that we experience. So something is hot to you, it is hot temperature wise, but you feel that it is hot because your brain tells you that it is hot. So it stands to reason that if you begin to believe that what you're going to do is going to have positive benefit for you in the long term, you're going to receive some sort of positive benefit from it. Mm-hmm. Even if those treatments might have marginal benefits clinically, or might even be quote unquote placebo in effect, right? Like, that's why placebo studies work so well, is because we're able to test an intervention against the normal positive bump that you would get, so to speak, from a placebo or an inert intervention.